Good evening. Welcome to the Paul Torrens Health Forum, the UCLA Fielding School of Public Health's ongoing program featuring health leaders discussing and debating the issues of today. I'd like to also welcome those of us joining us via our live stream tonight. I'd like to remind you at this time to please turn off and silence any electronic devices. My name is Eric Wilkes. I'm with the school's Office of Development and Alumni Affairs. I'm usually in the background of this event, helping organize this, not usually front and center. But I'm pinch hitting tonight for Leah Vriesman from our Department of Health Policy and Management, who is unfortunately delayed in traffic. It was her effort tonight that brought together our topic and our speakers today, so we thank her in absentia. She should be here in 15 to 20 minutes, traffic permitting. But we have a wonderful panel tonight, and I'd like to introduce Barbara Demman, who is serving as our moderator. You probably have the program book with her bio, but just to summarize, she is a board-certified acute care nurse practitioner and clinical nurse specialist with 20 years of experience. One of her primary areas of interest is in decreasing burnout symptoms and compassion fatigue among healthcare providers. She is the creator and facilitator of a course called SHARP, which is Stress in Healthcare Awareness, Reduction, and Prevention, and is a workshop leader at the School of Compassionate Action. She also leads weekly mindfulness drop-in sessions at the School of Nursing and at the UCLA's Counseling and Psychological Services. So please join me in welcoming Barbara Demman.
Good evening, everybody. If you're like me, you've had a long day, so this is really nice we're all together. Just real quick, just curious, who's in the room right now? So we can just do by raise of hands, looking at what kind of disciplines are here. So anybody from medicine or aspiring medicine, studying medicine, okay. How about nursing? Any nursing? Okay. All clustered together. We're seeing a pattern here. And any other health disciplines at all that I did not mention yet? Yes, what are they? What health disciplines?
Administration, project management.
Administration. We are so happy you are here, our admin. Thank you, yes. Yes?
Health and psychology.
Health and psychology, thank you, yes.
Managed care and executive advisors.
Managed care and executive services. Wonderful. All our leaders are here. And I know also there's aspiring healthcare professionals here as well, so we welcome everybody. So my role as a moderator is first to kind of introduce a little bit about the topic. And I have some slides. Oh, just go ahead. Perfect, thank you. Okay, so I'm just quickly going to define something. So, the title of our talk here is Burnout. So what is it? And I'm briefly touching on it as we have our excellent moderator panel people to discuss it further. But basically, it's a syndrome of 3 states. We have emotional exhaustion, depersonalization, and a diminished personal accomplishment, all leading to burnout. Emotional exhaustion, just that feeling of drained, okay, really drained. Depersonalization, starting to detach, maybe even a little cynicism, talking about patients as room numbers instead of people, these type of things, and then a little bit of diminished personal accomplishment as well. It's very common to go home and feel like you didn't have enough time or resources to do your job, and it can be very overwhelming chronically. Who experiences it? Well, 54% of doctors say they are burned out. That means of you two physicians, you're burnt out, and then you're burnt out, and you're burnt out, and you're burnt out. It's quite a bit. 88% of doctors are moderately to severely stressed, and 59% of doctors wouldn't recommend a career in medicine to their children. I mean, that is pretty significant. I come from a father who is a cardiologist, and he told me from the get-go, Babs do not go into medicine, so. Nurses for burnout. According to the American Nurses Association, 1 in 3 nurses report inadequate staffing levels. 2 in 5 say their units are short-staffed. 54% report excessive workloads. 96 out of 100 say they're tired before they even start their shift. And half of nurses say, I don't have enough time to be with my patients, okay? All of this leading to this phenomenon of burnout. Who gets burnout? Well, in the physician world, emergency medicine is at the top, as well as same for nurses, intensive care, internal medicine, OBGYN. At the end, we have derm, which is why it's such a coveted residency, I think. But, just kind of some interesting facts, and this is reflected in nursing as well. And what are the causes? Heavy workloads, long shifts, too much overtime, relationship conflicts possibly, lack of managerial support, high emotional needs of patients and families, and lack of reward. So just kind of presenting what we might be talking about today. And what's been associated with it? High rates of job dissatisfaction, increased employee absenteeism, which this is a big problem, declines in empathy and professionalism, poor patient care and satisfaction rates, statistically increased medical error rates, and elevated rates of substance abuse and suicide or depression. Most important, though, is this decreased quality of care, and especially with the physicians, the effects that this might have on the rest of the healthcare team. Not to mention, it's expensive, okay? To lose one nurse and hire another one can cost anywhere around $40,000 to maybe $55,000. And there's an average loss per hospital that's pretty hefty as well. So burnout is expensive. And the thing about it is, it's a cycle. So it won't stop unless somewhere we intervene. So we have burnout, nursing turnover, nursing shortage, inadequate staffing, job dissatisfaction leading to burnout, along with the medical world as well and other healthcare providers. And then we have this little cartoon. So you see the healthcare staff here working, and then they say, Frank just up and exploded. I hope I never get that burned out. And the question is, how can we really move from just hoping to actively preventing? What can we do? We know this phenomenon exists, so what can we do to prevent this? So we're lucky today to have such expert panelists here to talk about that.